Maybe we have to test system here. Hello? Yeah. Is it? You can hear? Yeah, okay. So,
Once upon a time, Once upon a time, the Earth was a huge playground for us bacteria. Those were joyous days. We were wild and free, helping or hurting people and animals as we wished. Then one day, humans invented antibiotics, a weapon that took this power from us and put them in control. We were no longer free to cause pain, disease and death among humans and animals. But we waited. And humans made a fatal mistake. They used these precious medicines indiscriminately in humans, plants, and animals. And some of us realized we could develop a defense to these antibiotics. Humans call this phenomenon antimicrobial resistance. We call it taking back control. Now we, the disease-causing bacteria, can spread wider and faster where disorder, dirt, and disorganization reign. It's great for us when you have poor hygiene and don't use water and soap. We love when you flush your unused antibiotics down the sink or toilet. They join our already huge colonies in your wastewater and river systems and make us stronger. Poorly managed hospitals are good for us. In these places, we're free to multiply and become new ruthless killing machines. Antibiotics given to animals not to control or treat disease, but to make them grow faster, create new armies of bacteria that become increasingly resistant. The beautiful thing is that the simple contact between infected animals and humans can allow us to spread. We can also circulate in contaminated food, on plants, in the soil, and in water. We can be everywhere. We've regained some of our old powers. However, I am becoming very worried. Our enemies are starting to work together. International organizations and countries are starting to coordinate all sectors, from human, animal, and plant health to agriculture and food safety, to halt our glorious expansion and stay on top. They explain to people that we can be stopped by using antibiotics, as per doctor and veterinarian's advice, and not for growth promotion, by adequate wastewater management, and by having proper hygiene and cleanliness at the hospital and at the farm. Humans could become wiser and keep us down. A disaster. Imagine if everyone listened to their advice. I am no longer safe. My ability to resist antibiotics could disappear. Don't let antimicrobial resistance take control. Be responsible when using antibiotics.
Good morning, Tom.
Hi, good morning.
Yes. Okay, I think sound system is okay. So that is great. Yeah.
Hello, good to see you.
Hello. Yes, yes. Thank you very much. It is early morning in Rome.
It is very early morning and it was a very late night because
Sorry.
we have a meeting in Canada.
No. Oh, you are in Canada right now?
No, virtually, just virtually.
Okay, okay. Okay. Thank you very much for your
My pleasure.
kindness. Yeah. Okay, okay. Thank you. We are testing the system. Okay. Dr. Vishanu, Sawadee Krap. Can you unmute? Can you unmute Dr. Vishanu? Oh, my name is appearing here, so we'll just change Dr. Vishanu. Dr. Vishanu. Where is he now? Dr. Vishanu. Disappear?
Hello, I am Dr. Vishnu. Yarenda. Can
Yeah,
you,
yeah, we can hear you. Yeah.
yeah, but you can see that in my photo. Okay, you already put my name on the
Yes.
photo. Okay, thank you.
And we have given a panelist, right? Yeah, Dr. Visanu.
Yeah.
Yeah. Okay. Okay. I think it is fine.
Yes. Thank you.
So yeah, thank you very much. Yeah. Okay.
Thanks for the time. Yes.
Good morning, Nishi. Good morning, Nishi. Can you unmute, Nishi?
Hello, Gongo. Can you hear me okay?
Yeah. Yeah. So for presentation, first you will present or Dr. Siswanto on session 1. How we'll plan? We have to inform Scott.
Yeah, please sis want to go first and then I follow. It's a alphabetical order. I think it's sounds nice.
Okay. No problem. It is up to you. So I will inform Scott accordingly. So we just wanted to check. And it will be good if we can try to have short presentation because time management will be a challenge. So we have one more presenter. So that's why it would be appreciable if we try to have short presentation. Yeah, it is for everyone. Yeah. Thank you.
So just one question. Are you going to share the screen from your end or we are supposed to share our screen when we present?
No, what is convenient for you? You can share from your side, but please open your file so that we do not lose during this sharing.
Thank you, noted.
Yeah, you can share from your side. There is no problem. Yeah.
Thank you. Sis.
Okay. Okay. Thank you.
Hi, Simone.
Hello, how are you?
Good, good.
Good to see you.
Good to see you.
Bon dia, Signora.
Bon
He is
dia.
so kind. Yeah, he is so kind. It is early morning in Rome, and he has meeting in Canada. You see, so.
Oh, thanks, Tom. Thanks for being with
You're
us.
welcome. I wish I was with you, but
Yeah, we are all willing, wishing to have physical meetings, but at least we can have the technology to allow us to see each other.
it does work very well, I have to say. But you see, a meeting like we had the other year in Rome, you know, something like that would be good again.
Oh,
you know,
yeah,
at least the fun meetings, you know, we should have.
Yeah, it was so good. It was very good.
Yeah, I have
Hopefully we can have one again very soon.
I hope to have one this year, at least with my team. But because we also have been all over the world, really. I haven't seen them, most of them, in 2 years. Okay. So you're in Manila? Simone? Yeah.
Yeah, I'm in Manila since last year.
Take Jean. Good morning, Jean. Hello.
Hi, Gungo and Simone. Good morning. Just to test my microphone.
Yeah. That is great. Yeah. So please prepare your presentation in desktop so that we will not lose time during this sharing presentation.
Sure, of course. Just would like to double check for the pre-recorded presentation from Delphi. Will you share or you prefer us
Good
to
morning.
share? Oh, okay.
Yeah.
It's always busy before the meeting.
Hello, Scott. Can we check the system? Please unmute.
Yeah, good morning. How are you?
Good morning. Yeah, fine. So
Good. Let me
it
just
is
check
excellent.
if I just try to share my screen and make sure you can see well.
Yeah. Yeah, we can see. Yeah.
Okay.
So, yeah, thank you.
Yeah. Okay.
Now, may I request Mary?
Yes.
Mary Joy?
Yes,
Yeah.
Banggal. Yes, Banggal.
Yeah. Can you check your slides?
Bongal, I'm
sure.
sorry, but
Yeah.
when Scott shared the screen, it was not on presentation mode.
Yeah, we have to request to have in presentation mode.
Yeah, please check, Scott, because it was showing like when you have two screens, then in the one side you have the presentation mode, the other side you have the presenter mode. That was what we were seeing.
Yeah. You are right. So can you make?
Yeah.
Is this okay, or do I need to change a setting?
Hello?
You need to change.
Yes.
So swap.
Yeah, better now. Good.
Hold on one second.
That's always tricky.
Yeah, just trying to get it so I can see my notes. Okay. Can you see now or not?
We can
It's
see
on
your
presenter
notes.
mode. Yeah, we can see your notes.
I don't want you to see my notes. Okay, so what do I have to do? Do you have any instructions on how to make them disappear here?
Usar la pantalla. Si está usando las pantallas, tiene que hacer stream de la pantalla que. Al final no se puede usar eso.
Yeah, I think when you share your screen, are you using two screens?
Yes.
You have, when you share the screen, you have to choose the other screen.
All right, let me try one last time. How about now?
Perfect.
Okay, so here you see my slides, but not my notes.
Yes.
Perfect. All right, I'll just advance one more time, make sure it works.
Yeah, it's perfect,
Excellent.
Scott.
Yeah.
Okay, great. All right.
So we already have 155. Maybe we have to start right now.
Uncle, can I just check my screen?
Yeah, please. Yeah, just 5 minutes. We'll wait. Yeah, 1 minute is left.
Okay, hang on. You see it?
Yeah, excellent. Yeah.
Okay, good.
Sorry, Gungal, I'm going to try one more time. I just want to make sure I know which one to
fine.
select here. Is that fine or not?
Yeah, fine. That is.
Okay.
Now it is okay. Yeah. So
Great.
why this is? We do not need. She is attending from. So we can remove this one right now. Shall we start? Yeah, because otherwise we'll lose time. Good morning for Europe and part of Asia. Good afternoon for Asia and Australia. Good evening for America. We have participants from all the continents, and it is our great pleasure to welcome all of you. We are organizing together with FAO-OIE this webinar, and this is strategically organized just before the regional multi-sectoral collaboration workshop, which we organize together. That is 9th Regional Multi-Sector Collaboration Workshop. And it is, there are series of pre-workshop webinar on AMR, and this is one of them. And we have a strategic approach to organize this webinar ahead of World Antimicrobial Awareness Week, which is going to happen in November. We have invited participants from different sectors: human health, animal health, food safety, and academic sectors. And we have been using this tripartite platform to advocate for AMR. We started from 3rd tripartite workshop, which was held in Bali in 2012. Since then, we are using this tripartite platform to promote multidisciplinary approach for containment of antimicrobial resistance. First of all, I would like to invite Dr. Poonam Khetrapal Singh, Regional Director, WHO Regional Office for Southeast Asia, to deliver opening remarks on the behalf of Tripartite. Now we are playing pre-recorded remarks.
Good morning to all. It is a pleasure to deliver these remarks on behalf of the World Health Organization, the Food and Agriculture Organization of the United Nations, and the World Organization for Animal Health, that is OIE. Antimicrobial resistance is a global health and development threat. Globally, unless urgent action is taken, by 2050, AMR will be responsible for 10 million deaths annually at a cost of $100 trillion US. If current trends continue, AMR could reduce the GDP of low-income countries by 5%. pushing up to 28 million people into poverty. AMR already kills an estimated 700,000 people every year in what is a slow tsunami that is reducing the effectiveness of medicine and healthcare, impacting food security and safety, and impeding progress on the Sustainable Development Goals. AMR is a critical concern for human, animal, and environmental health, including through the potential transfer of resistant genes in the food chain caused by misuse, highlights the need for countries and partners to take a multi-sectoral approach to addressing AMR, prioritizing action at the human-animal-environment interface, what is known as the One Health approach. The global tripartite between WHO, the FAO, and OIE is responsible for promoting, coordinating, and facilitating One Health activities across the world based on the Global Framework for Development and Stewardship to Combat Antimicrobial Resistance Roadmap. Commendably, most low and middle-income countries in the Asia-Pacific, including all countries of the Southeast Asia region, have developed AMR national action plans. But achieving full implementation continues to be a challenge. To strengthen implementation capacity, the Tripartite's multi-partner trust fund will continue to provide targeted support to low and middle-income countries, including in the Asia-Pacific. Food systems are an increasing area of focus in the battle against AMR. The misuse and overuse of antimicrobials in agriculture production, not only for human and animal health, but also for the environment. As early as 2006, the Codex Alimentarius Commission established a first task force on antimicrobial resistance with the aim of developing science-based guidance on how to assess and manage the risk to human health associated with the presence of antimicrobial resistant organisms in food and feed. In 2017, an ad hoc Codex intergovernmental task force on antimicrobial resistance was re-established in the context of the launch of the WHO Global Action Plan on AMR, and amid rising concern about AMR as a food trade issue. At the recently concluded UN Food Systems Summit, the need to prevent and combat AMR was identified as a key cross-cutting issue, essential to achieving global food system transformation. Across all aspects of AMR, the COVID-19 pandemic has added to our challenge. A survey assessing the impact of COVID-19 on the prevention and control of AMR in 73 countries highlights reduced availability of nursing, medical, and public health staff for AMR efforts. Disruptions to routine immunization services have the potential to increase the risk of infection from vaccine-preventable diseases, potentially leading to an overuse of antimicrobials. Individuals presenting with mild COVID-19 disease are too often prescribed antibiotics when they do not require them, contributing to AMR. Now, more than ever, we must redouble our efforts to prevent and combat this health and development threat. Each year, the Global Handle Antimicrobials with Care campaign culminates in November with World Antimicrobial Awareness Week. The theme of this year's World Antimicrobial Awareness Week is Spread Awareness, Stop Resistance, a theme that is especially important to this tripartite's efforts to promote, coordinate, and facilitate One Health collaboration, of which this webinar is just one example. In the coming session, I urge all participants to carefully consider how they can enhance One Health awareness and action generally, and how they can increase responsible and prudent use of antimicrobial agents in agriculture specifically. Together, we must continue to highlight the need for all stakeholders to adopt the One Health approach to increase the effectiveness of medicine and healthcare, improve food security and safety, and accelerate progress towards the SDGs. Thank you.
Thank you, RD ma'am. The message is very clear that we all have to work together for containment of AMR, and even UN Food System Summit, which was held last week, discussed about AMR as a global threat. Now I would like to request Tom Highland, Director, Codex Secretariat, Rome, to deliver opening remarks. Tom. Yeah.
Thank you very much, and good morning, good evening, good afternoon to everybody, and thanks a lot for inviting me to this webinar. The tripartite One Health approach to AMR mitigation and safer food is the only approach that promises success. As has been outlined impressively by the regional director, AMR is a topic that concerns everyone, everywhere. It is important to talk about it, as in this webinar, to inform about the activities and solutions that the international community can offer and what the country perspectives are. If more and more countries know the problem and know that there are tools to do something against it, we will be able to avert the worst. In Codex, we are entering a decisive moment in our work on AMR, a decisive moment in a changed world. Codex, as you know, is where the world comes together to negotiate science-based standards that protect everyone everywhere. This is our vision. We have been very successful over the last 2 years to transform our work methods, not only to survive, but to transform and be better. Thus, Codex is open for business, and more so than ever before, we are seeing a 30 to 50% increase in the countries participating in our work, and we will do all we can to never lose these additional countries again. Why? Because international standards are important. Standards are the building blocks of modern life, and in particular modern food production and trade, and the more countries actively participate in setting the standards, the more they feel ownership, and the wider they are applied, and the more impact they can have. Codex is the place to negotiate standards to protect the health of consumers and ensure fair practices in the food trade. It is a member-driven process. Everything that Codex does comes from the members. 188 member states and 1 member organization. Member-driven, and I sincerely hope that the members will drive on the fast lane next week so that we can still arrive on time. Next week, we will start the 8th and for the moment last session of the Task Force on AMR, which has been so generously and capably organized by the Republic of Korea. There are 2 important texts under development: the revision of the Code of Practice to minimize and contain AMR, and the guidelines on integrated surveillance. They need to be completed, and they need to be completed timely. Both of these, together with the Codex guidelines for risk analysis of foodborne AMR, will create a complete system for members to base themselves on. We have come a long, hard way, and we can complete this work. If members come, if they come prepared, if they come with a willingness to compromise and move forward in the interest of all. Yes, we can fulfill the ambition and adopt both texts this year. If we don't, we cannot blame the pandemic, because we are prepared to organize this meeting in the best way that we can. I'm not only saying that because it is important for Codex to complete this work. The Global Leaders Group has also mentioned this as a key indicator in their rolling action plan. When adopted, and I'm not saying if. When adopted, the next task comes, which is implementation. The tripartite collaboration will be crucial in all implementation efforts. We are in the amazing position to have agreed recently on a project generously offered by the Republic of Korea, supporting the implementation of Codex text on AMR. In the Asia region, for example, it will work in 4 countries as a start: Mongolia, Pakistan, Nepal, and Cambodia. We will lead this work together with FAO. FAO also have funding from Canada to support implementation of the Codex risk analysis text on AMR and will be developing further guidance on piloting it. AMR is a complex and scary threat, but a lot of good work is going on to contain it, and I'm hopeful and look forward to the progress that we can all make together on it over the next few years. I wish you a very good webinar. Thanks a lot.
Thank you, Tom. This AMR is not only human health, animal health problem, but it is also food safety and food trade issue. And FAO-WHO Codex Alimentaris Commission has been recognized by World Trade Organization as standard setting organization for food safety. Now we'll have ice-breaking session, Mentimeter. I would like to request Dr. Simone Moraes Rajel. She is Technical Officer Food Safety from WHO Regional Office for the Western Pacific.
Thanks, Gongal. Thanks, Tom, for your very nice words, and good to know that we are hand in hand with Codex. Hello, everyone. Good morning, good afternoon, and maybe good evening to all of you. We are now having an icebreaker session. I'm seeing that a lot of you are greeting everyone from the chat box. Please continue to do so. But I would like to invite you to access menti.com. You can also use the link that was shared in the chat box, or you can use the camera of your cell phone using the QR code that you are seeing on the screen now. I see that we have around 105 and going up people inside and already connected to Menti. Yeah, good to see a lot of people joining. Maybe we can start going to our first question. We would like you to respond. Where are you from? You can write the name of the country, area where you are from, so we will have an idea of from which country, area, or territory are you from. So to give a bit understanding of all the participants. I will give you some minutes to respond. We see, and as bigger the letters, more people are responding. So in this case, we have a big group of people from Thailand, Philippines, Indonesia, Singapore, India. Let me see if I can see all. Cambodia, South Korea, Germany, Cook Island, New Caledonia, Australia, Saudi Arabia, France. So nice to see different territories joining us in this session today. Lao PDR, Malaysia, Myanmar. Yeah, I think we are good. Italy. Next question. In one word, what do you associate with antimicrobial resistance? Don't be shy. First word that comes to your mind. Yeah, interesting. We have some positive and negative aspects. One health, human health, but then we have its connected policies, cholesterol, superbugs, regulations concerning surveillance, fear, diseases, regulation, So interesting. So there are so many feelings and aspects related to antimicrobial resistance when it comes to our mind. The first thing, misuse, I'm seeing threat, pandemic, food safety, animal health, all the aspects here. So nice. We have 102 response, I think. Yeah, it's still moving. Yeah, 122. Yeah, and then we can see again, the bigger the letter, the most responses were related to that. So One Health, surveillance were the most answers we received for this question. I think we can go to the next one, and concerning of the time. In your opinion, what are the measures needed for AMR containment in the Asia-Pacific regions? In your opinion, what are the measures needed for AMR containment in the Asia-Pacific region? You can type AMU surveillance, regulation, education, PPS, proper regulation, proper prescription, countermeasures, raising awareness, education, regulation, education, and surveillance are now the biggest one. Effective registration, data platform, coordination, awareness, enforcement, yeah, we see so many connected concepts here. But again, regulation, education, and awareness and surveillance are very much among the most suggested measures or indicated measures. We do have a lot of measures to be taken, and I think it's clear for everyone which are the measures. We do recognize that it's not easy to implement those, but I think it's important to know which are the measures and how we can work together on that. Next, please. So we can move to the next one. AMR is an issue affecting public health, animal health, food safety, and environment. And this is for you to agree or disagree. Let's give you a few more seconds to say if you agree or disagree. Yeah, it seems that the majority of the participants agree that AMR is an issue affecting public health, animal health, food safety, and the environment. Let's go to the final question, and we want to check a little bit the knowledge you have. How many people die each year from infection by drug-resistant pathogens and parasites? You have 4 options: 7,000, 700,000, 1 million, or 10 million. Now we will wait a little bit for the participants to mark the answer, and then we will show you the right. Let's see, we have going up almost 70. We are almost reaching yeah, okay. Thanks for those who responded. A few more seconds, we're almost 100. Yeah, almost half of you selected 700,000 people that die every year, each year from infection by drug-resistant pathogens and parasites, and you're right. This is the right answer. 700,000 people die each year from infection by drug-resistant pathogens and parasites. It's a huge number that could be prevented. I think we went to so this was the last one. Thanks everyone for joining this interactive session. We will have another interactive session tomorrow, so please join us again. I will now hand over to my colleague Gongal and wish you all a very fruitful meeting today. And I'm pretty sure that will be very interesting, and we will learn a lot from the sessions today. Thanks. Over to you, Gongal.
Thank you, Simone. It is very interesting to see wide response, even in live stream in our website. And the key message is that if we do not act now, by 2050, 10 million people will be dying due to lack of antibiotics, which is effective. So we all have to work together, and there is a need of multidisciplinary approach. So one sector cannot solve this problem. So that's why it is important to educate, create awareness about this problem. So we'll be trying to see how we can work together for World Antimicroresist Awareness Week at the country level. Thank you very much. Now I would like to have overview of this session. So let me check here. Okay, share screen. So there is a problem. Let me share screen. What is the problem here? Let me check. Yeah. Share screen. So I have here this one. Yeah, this one. Yeah. Okay. Yeah. Oh, yeah. Yeah. Okay. Okay. Thank you very much. Yeah. Yeah. Not well. Okay. Yeah. Okay. Thank you very much. It is expected that we may have some problem in IT. The objective of the webinar is to provide a briefing on AMR as food safety issue and its implication on public health and food trade. And it is also important to advocate the role of human health, animal health, food safety, and environment sectors in containment of AMR using One Health approach, to provide update on relevant capacity building activities carried out by FAO, OIE, and WHO, which will be done today, and to provide update on OIE international standards, progress made by FAO WHO Codex on Code of Practice and development of guideline on integrated monitoring and surveillance of foodborne antimicroresistance. So today it will be general session on FAO-OIE WHO activities, and tomorrow will be specific on international standards and Codex work. I would have some housekeeping announcement. Please rename yourself on Zoom to include your name and organization. Please mute yourself during webinar. And I would like to request moderator and presenter to switch off mobile or put on silent mode. Please use question and answer function for question, and please identify presenter from whom you want to get response, because we'll have little time for interaction, and we'll make sure that our presenter will respond to your query in Q&A box. Attendees are welcome to make comment in the chat box, and we could see a lot of comments. To save the time, short introduction of presenter will be posted in chat box. And attendees are encouraged to do physical exercise during break when dancing video will be played. This webinar will be recorded and shared with attendees. Last but not least, it is important to get comment, feedback from participants. So attendees are requested to provide feedback using online evaluation form. Now we'll have a group photo. Please open your camera. All participants are requested to open camera so that we can take photo. At least we know who are in this webinar. Yeah. We have almost 222 participants. So we will wait for 1 minute to give you opportunity to open up camera so that we have group photo. So let us start here. Yeah, we are doing. So it is done. Okay, thank you very much. Now we are going for technical session. It will be moderated by Scott Norman, who is a wildlife veterinarian with extensive international experience managing and implementing multidisciplinary One Health programs at the human wildlife livestock ecosystem interfaces, not only in Asia, but also in Africa, North America, and Europe. He has worked in academic settings and for NGOs as a research scientist, and has been with FAO for over 15 years, focused on animal and antimicrobial resistance and food safety, zoonotic and transboundary animal diseases, prevention and control in people, livestock, and wildlife, sustainable agriculture development, and natural resource management. Now, floor is yours, Scott.
Okay, thank you very much, Dr. Gongal, and welcome colleagues and participants. It's really my honor to have the opportunity to chair this session and also to make the first presentation. Let me share my screen. Okay. Can you see the screen well?
Yeah.
Okay, super. Great. So I'm going to make a short presentation on FAO's regional activities, and this presentation has been put together by myself and Mary Joy Gordonchilo. As many of you are aware, in 2015, the Global Action Plan on AMR was endorsed at the World Health Assembly, and this was used as the foundation on which countries were asked and have proceeded to develop national AMR action plans. And I think that this was really a fantastic first step. As a result of that, and following in line, FAO moved forward with developing an action plan on AMR, focusing on the actions to be taken by the food and agriculture sector. Most recently, we've just updated this action plan, and it further aligns with the global plan and also integrates lessons learned from the first phase of implementation. Now, the action plan from FAO has actually 5 objectives, and those 5 objectives involve strengthening governance and allocating resources to accelerate and sustain progress, promoting responsible use of antimicrobials, increasing stakeholder awareness and engagement, strengthening surveillance and research, and enabling good practices to prevent infections and control the spread of resistant microbes. These are the target areas of work pursued by the different offices at FAO, and it includes multiple offices as well as multiple divisions and technical teams at FAO globally, as well as here in Asia and the Pacific region. Now, FAO aims to increase awareness of AMR risks in the food and agriculture sectors and engage people in changing their practices. And this is really, to a large extent, what Pillar 1 focuses on. This is accomplished through awareness raising, risk communication, behavior change programming, targeting different stakeholders. Key stakeholders on the AMR in Asia include farmers, practitioners, students, animal health authorities, policymakers, and private sector, among others. FAO reaches these stakeholders through a variety of different activities and with different key messages depending on the stakeholders involved. We use media, print, video, social media, live interactions, as well as organized campaigns. And many of these happen right around World Antimicrobial Awareness Week in November from the 18th to the 24th each year. Pillar 2. Globally, FAO contributes to building evidence through strengthening surveillance and research on AMR, AMU, and residues. Overall, this is achieved through placing efforts and initiatives towards improving AMR laboratories, epidemiology units, and overall implementation. At FAO RAP, our regional office, surveillance of AMR, AMU, and residues has been a major area of work. Various surveillance tools and mechanisms are continuously being developed and made accessible to countries within the region. I think that I won't spend much time now highlighting any of these tools because there will be a later presentation by Joy, who will go into more details on the surveillance tools that you see pictured here. Pillar 3. FAO also aims to reduce the need for antimicrobials by facilitating adaptation of various good practices in food and agriculture. This will be mainly through facilitating access to guidance on infection prevention and control and implementing interventions towards this end. FAO's regional office for Asia and the Pacific is mainly building on the concept of IPC and WASH, water sanitation and hygiene in human health sector, and transposing its principles to agricultural settings through Agri-IPC and Agri-WASH. This concept will mainly focus on interrupting the transmission of infectious agents across hosts and their environments with the use of existing and future FAO tools. Pillar 4. FAO also contributes to the One Health approach towards AMR mitigation through promoting responsible use of antimicrobials. Globally, the vision is to provide guidance and a reinforcing environment to facilitate interventions towards this end. The FAO Regional Office for Asia and the Pacific continues to work to reinforce prudent use of antimicrobials in the region through understanding the state of use in countries, creating and supporting antimicrobial stewardship networks, and developing schemes to support prescribers and other stakeholders. And finally, Pillar 5. FAO reinforces these various initiatives by working with governments and partners towards better governance and sustainability. This work focuses on policies and regulatory frameworks, research and innovations, partnerships and collaborations across technical and institutional sectors. The FAO Regional Office for Asia Pacific works closely with countries and relevant partners in the region, including ASEAN, SAARC, SPC, FAVA, and others, to create networks and mechanisms for support and further synergy in the region. One example is the establishment of the Technical Advisory Group in Southeast Asia and South Asia. Each of these 5 pillars of work are interconnected and complementary and ultimately contribute towards achieving FAO's overarching AMR goals. The first goal is to have AMR levels reduced and the emergence and spread of resistance slowed across the food chain and all food and agriculture sectors. The second goal is to have antimicrobial efficacy preserved while sustaining food and agricultural production. This is FAO's work and vision for the region. All of the regional and global efforts are meant to support countries and stakeholders like you to complement and reinforce commitments to address this evolving global health issue. In the end, if we all work together, everybody wins. Our collective work on AMR and food safety, aquaculture, crops, and animal health is also supported by multiple funding partners who make these initiatives possible, and we're very grateful for this kind of support. FAO has regional technical units, including the Animal Health and Production Unit that includes ECTAD, food safety, fisheries, and crops, as well as country teams that focus specifically on AMR. This is a collective effort that also includes country counterparts and partners in the region, including the Tripartite. With that, I'd like to close and say thank you for the opportunity to make a presentation on behalf of FAO, and we'd be happy to take questions, I think, via the chat. And without further ado, what I'd like to do is actually introduce the next speaker. Okay, the next presentation will be made by OIE. Excuse me, I'm trying to end the slideshow. It will be made by OIE, and it will talk about OIE's regional AMR activities. And the presentation will be made by Dr. Jing Wang, who joined the OIE regional representation for Asia and the Pacific in May 2017. I believe the additional information about Dr. Jing Wang is available in the chat. And without further ado, I'd like to turn it over to her.
Thank you very much, Scott, for introducing me and also the OIE's presentation. So just let me share my screen. May I know if you can see my screen now?
Not yet. Maybe you can reshare one more time. I had a similar issue.
Just let me do screen sharing. How about now? Still no?
Still not visible.
Okay, I will just switch to single monitor. So I hope now you can see my presentation. Still no?
Still, we do not see. Maybe it needs to be closed and reshared again.
Sure. So you still can't see my screen?
We cannot, unfortunately. I wonder, yeah, Dr. Gongal, do we have a copy that could be projected from your side, and we can just
sorry,
allow...
we do not have a copy from OIE.
Maybe I can just send my presentation to Gongal now, and maybe WHO can start their presentation first.
Okay, that would be great. So,
yeah, thank you.
WHO, the WHO presentation will be made, I believe, jointly by Dr. Siswanto, who's currently the Senior Advisor for Science Research and Innovation, and also Dr. Takeshi Nishijima, who is the focal point for antimicrobial resistance at WHO-WPRO and supporting the WPRO COVID response. Again, further information about both of these presenters are available through the chat. And I'd like to ask Dr. Siswanto and Nishijima if they would be willing to share their screen and make their presentation.
Yeah.
Thank you, Scott. So, good morning, good afternoon, good evening, colleagues and participants. So, I am very pleased to be here. So, my talk is about EMR activity in the Xiaro region. So, next slide, please. So, this slide just showing to us that Xiaro has established a strategic framework on how to achieve triple vision target through 8 flagship priority. And the strategic approach that RD already established is on how to sustain and then to accelerate and then to innovate. Yeah, that's a very important strategy here. Next slide, please. So here we can see that antimicrobial resistance is one of the Xiaro flagship out of the 8 flagship priority. That is, the objective is to build national capacity for preventing and combating antimicrobial resistance. So EMR is one of the 5 priority in the Xiaro region. Yeah. Next slide, please. So in this slide, it's showing us that all 11 member states in the region has established EMR National Action Plan, and all member states with multi-sectoral approach. I think this is very important with multi-sectoral approach, as we already aware that One Health approach is very important, but the endorsement is varied mostly from Ministry of Health. But we can see here that 3 countries have endorsement with a higher level, like in India, also in Thailand, also in Sri Lanka. So because higher endorsement is very important to make easier implementation with the NAP. So we can see here that also some of the national action already expire and also will expire in 2022. So the NAP updating is something that should be done, and this will be providing opportunity to develop NAP in line with the NAP 0.2, because NAP 0.2 is very important in terms of participatory approach of multi-sectoral. Next slide, please. So this EMR activity of the progress EMR activity in Xiaro. So we can see here that the region has implemented EMR program. In fact, before the adoption of the CAP by World Health Assembly in 2015. In fact, in Jaipur Declaration that done in September 2011 has marked the initiation of EMR program in Xiar. And then by step, the region has been implementing the 5 objectives of the GAP, including strengthening of the surveillance, like glass EMR. Now, all 11 member states already joined glass EMR, but still 5 member states joining EMC surveillance. Yeah. So next slide, please. This is just to make an illustration with regard of campaign during the World Antimicrobial Awareness Week in 2020. So we can see here in Myanmar, also in Indonesia. And this campaign is very important in terms of raising awareness, also to educate people with regard of EMR. Next slide, please. Overall, the activity of antimicrobial containment in Xiaro basically has been done, but some has been done in all member states, but some still in certain and limited level. Just to mention here, antimicrobial stewardship program, for example, have been done, but still in limited and certain level. And surveillance, as already mentioned, that all member states has joined EMR, but only 5 member states formally joined in EMC surveillance. IPC was already done, and this activity basically integrated with health system development, also with health emergency, especially in with regard of COVID-19 pandemic. So there is a collaboration actually with health emergency and EMR program. Also research, it is very important with regard of implementation research, and this done in collaboration with TDR program. So to provide better policy and better action in EMR. Yeah. Next slide, please. Yeah, I think this is my last slide. So just to conclude that CRO basically has spearheaded EMR containment program. In fact, before it went globally, then the adoption of the GAP in 2015, and then all member states have developed EMR NAP with multi-sectoral approach with variation in at endorsement level, some mostly by ministerial head, but some is in higher level. And with regard of EMR activity in the context of GAP objective, some key activity has shown satisfactory achievement, but others still need to strengthen, of course. Others still need to strengthen. And then the last but not least, with regard of technical support function, the regional office has provided technical support to member state in line with, of course, member state needs. That's my last slide. Thank you very much for your attention. Over to Scott. Oh, Nishi. Yeah, over to Nishi.
Okay, thank you very much, Siswanto. Just to stay with WHO, Nishi, are you ready to present?
Thank you very much, Scott, and also Siswanto. So may I ask the Shell Secretariat to share my slide from there? Citra?
Yes.
Thank you very much. Next slide, please. Yes, we very much think that how we deal with AMR is very different from other, for example, infectious diseases such as TB, to which we can potentially eliminate. But to eliminate AMR is very, very difficult. And then what we focus is to avert the impact of AMR by going ahead of the curve. So this is a very important concept when we are dealing with AMR. Next slide, please. Thank you. So this is a vision paper for WPRO and the member states in the Western Pacific region for the future towards the healthiest and also the safest region. So this is a vision for the WHO work with the member states and partners in our region. And we have 4 thematic priority areas, one of which is a health security, including antimicrobial resistance. So WPRO and also the member states thinks AMR as one of the very important issues in our region. And then this is a framework for accelerating action to fight antimicrobial resistance in the Western Pacific region, which is endorsed by the member states in October 2019. And then this framework considers the operational shift as new ways of working in the region to slow the spread of AMR and then avert its impact. All these operational shifts were in the vision paper. And then particularly for this AMR framework document, we focus on 4 operational shifts. Number 1, working backwards from the longer term goals, we call it backcasting. Number 2, championing health beyond the health sector. Number 3, system approach for sustainability. And number 4, building solutions from the ground up, or we call it grounds up. Next slide, please. Next slide, please. Thank you very much. This figure is a little bit detailed, and my apology for that, but this is a very key of our AMR framework document. So let me explain, for example, like operational shift 1, which is working backwards from a longer term goal, or the backcasting. As I explained, we will not be able to eliminate the AMR, so AMR will exist in the future. So what we do needs to be future oriented. For that, it is very important to keep political momentum or the interest to the AMR. So one of the things we are focusing on is that we are planning to have a high-level policy dialogue, and then we are working on to develop two important papers. Number one, which will be in the next slide as well, but we are developing with partnership with the University of Hong Kong to develop the disease burden paper in our region. We are seeing what will be an excess mortality and then cost because of the AMR in the next 10 years in our region. Also, we are working on to develop what will be the emerging issues on AMR in our region so that we can go ahead of the curve to respond early to those emerging issues. So this figure explains the 4 operational shift and then what is our strategy to tackle AMR in line with these operational shift. Next slide, please. Thank you very much. So this is exactly the disease burden paper we are talking about to estimate the excess mortality and then also the cost in the next 10 years in the region. We are focusing on 7 target pathogens listed here, and then based on the evidence or data available from our region, with University of Hong Kong as a partner, we are doing the modeling for the disease burden analysis. Next slide, please. Next slide, please. Thank you very much. So this is for in line with the operational shift to health beyond the health sector. We are doing the campaign and the awareness raising with the theme Stewards for the Future, One Region, One Movement. So this is meant to be a 5-year program. Last year we focused on the health professionals, and we are focusing for the patient groups for this year. But the idea is we are aiming to make a movement, what we call AMR movement, and then we are hoping that we can support the people building the network and then inspire each other to reach the level where acting against or fight against the AMR becomes kind of a societal norm and then our daily life. And then people, every one of us are doing something to fight AMR in our everyday life or in our work. This slide shows our pledge website. We are encouraging the people to become steward. Steward meaning, people who are making fight against AMR in their daily life. And then I'm pleased to inform more than 220,000 people have already made a pledge, but we are aiming for the million. So please visit this website. Next slide, please. Thank you. So this is the operational shift number 3, system approach. So this figure shows a WPRO strategy for strengthening AMR surveillance and also the stewardship and then outbreak response in our region. So antimicrobial consumption monitoring, stewardship program, and also the surveillance system, outbreak response, they are all interlinked. And then we are trying to develop a package to support the member states, starting from the antimicrobial consumption monitoring. And we have developed a system called WPRO, which I have an honor to present at a later stage of this webinar. And then stewardship, surveillance, outbreak response. For this surveillance system, to support building the surveillance system in the member states, and then also systematically react to the outbreak, partnering with the University of Melbourne, Doherty Institute, which recently became a WHO collaboration center for AMR. We are developing the regional guidance. And then we have, thanks to the expert in our region, we have incorporated the review comments, and then we are finalizing the document. Next slide, please. Thank you. Operational shift number 4 is a ground up. So using the evidence on the ground to inform policy and actions. For this WPRO's system to support the member states on the antimicrobial consumption monitoring. I have more time to present it later. Next slide, please. Thank you. This is the last slide. So we will continue to work together with the member states guided by the framework document about the impact of AMR with system building approach, which is a sustainable approach, we think. And then we will continue to support endorsement implementation and also revision of the National Action Plan for AMR. We will work together with the member states to further enhance momentum to move AMR movement forward and the increased political agility. Thank you very much. This is the end of my presentation. Back to you, Scott.
Okay, thank you very much, Dr. Nishi. That was great. And I really would like to extend congratulatory remarks to Dr. Siswanto and Dr. Nishi and WHO for their presentation on the regional areas of work related to AMR. Let's see if we can get lucky this time. And I'd like to hand over to Dr. Jing Wang and see if we can present her presentation and have her speak to the regional activities that OIE is undertaking here in the Asia Pacific region.
Yeah, thank you, Scott. May I request thank you. Thank you very much for the support and also apologies for the inconvenience. So good morning and good afternoon to all. In my presentation, I just will give you a quick updates about OIE regional activities on AMR. Next slides, please. So for those, in case if you are not very familiar with OIE, just would like to introduce you that OIE is a scientific and technical intergovernmental organization established in 1924. So OIE actually we have now a more preferred English name. Now it is a World Organization for Animal Health. One important point is in 1994, the OIE is recognized by the WTO as the international standard setting body for animal and animal products trade. So far, we have 182 members, 5 regional representations, and 8 sub-regional representations. May I move to the next slides? So in 2015, the WPRO launched the Global Action Plan. And after this, in 2016, the FAO and OIE also have our own strategy on AMR. So in this picture, you can see the objective of the OIE strategy is very much in line with the WPRO global strategy. Next slide. So in the OIE global strategy on AMR and the prudent use of antimicrobials, it actually covers 4 main objectives. The first one is improve awareness and understanding, strengthen knowledge through surveillance and research. The third one is support good governance and capacity building. The last one is encourage implementation of international standards. Next slide, please. So before we go into details about the activities organized by the OIE regional office, so let me look at the issues on AMR in our region. So in the past several years, we really recognize that our members made lots of efforts and also lots improvement regarding AMR and AMU in animals. And however, we also need to understand the legislation and enforcement to regulate import, production, sales, monitoring of antimicrobial is still weak, and also the supervision on the use of antimicrobials is still inadequate. And for some members without a risk analysis. Some countries still decide to use antimicrobials as a growth promoter. So this leads to a result that till now, we're still not very confident about the quality of the veterinary medicine and the over-the-counter sale, and also in appropriate use of antimicrobials, and also lack of data to support decision-making make the government a bit difficult to monitoring the implementation of their national action plan on AMR. Next slide, please. To address these issues, and also in line with the OIE strategy on AMR, the regional office conducted several activities to tackle this issue. The first objective, awareness raising. So the OIE developed several awareness material to promote and help members to understand how to responsible and prudent use of antimicrobials. So this is a poster and leaflets for the OIE 5 only rules. And next slide, please. Yes, and also since 2019, the Tripartite plus UNEP also developed to AMR awareness radio during the WPRO to help members understand why AMR is an issue and why we need to use a One Health approach. Next slide, please. We fully understand for the members, they may need some support from the international organizations to help them organize some WPRO activities. Thus, we support some members to translate the OIE awareness material and the tripartite awareness material into their local language and use it in their own national activities. And we also organize several webinars to help our members improve their communication skills for AMR, and also 2 webinars on responsible and prudent use in aquatic animals and in companion animal last year. Next slide, please. Next. Please, yes. Regarding objective 2, strengthen knowledge through surveillance and research. As it is agreed among the tripartites, the OIE is leading the AMU data collections in animals. So thus, the OIE developed the OIE global database on antimicrobial agents intended for use in animals. So till now, OIE launched already 7 rounds of data collection. And for the first 5th round, the report is available on the OIE website. So I can post that link in the chat box later. Next slide, please. I won't go into too much details about the global AMU database because my colleagues, Delphi from headquarters, will give a presentation later today. So I would like to more focus on the regional activities that we support members to collect their AMU data. So we recognize that for members, they have some difficulties to collect AM data from different stakeholders. So we organize an in-country AMU workshop to help them map up this AMU supply chain. By doing so, they can understand who is a key player and who is a key regulator at each level, and what kind of data the government can collect from this key player and key regulator. Till now, we organized more than 10 in-country workshops, and some initial funding we observed in this in-country workshop is Many countries import veterinary medicine products, and also some of them also manufacture that in their own country. And for most of the countries, they have a quite good regulation system for importer and manufacturer. However, if it go to the distributor, retailer, and more end user level, the regulation is a bit inadequate. And for the OIE global database, most of the country only collect AMU data at the national level. I just like to share one thing, because we noted that for members, there is also a strong request to collect AMU data at the farm level. So in collaboration with FAO, the FAO and OIE, we are now working on a AMU guideline at farm level, and hope we can have this guideline available at, as soon as possible. Next slide, please. To support members to strengthen their capacity, we also organize series seminar for veterinary education establishment and private sector. Next slide, please. Regarding the objective 3, good governance and capacity building. Yes, thank you. We organize several activities to help them build their own capacity, because we understand there are so many very excellent institutes in our region on AMR. To avoid any potential duplication, the FAO and OIE established this coordination group of leading AMR institutions in the region. And also, with the OIE collecting centers in Japan, ENVO, we conducted several laboratory trainings on AMR since 2015. Next slide, please. So as a conclusion, the OIE will continue to support the implementation of the OIE strategy on AMR, and we are also happy to support our members to implement their national action plan in close collaboration with our partners and collecting centers in future. So for the members, if you have any interest about the previous mentioned in-country workshop, please feel free to contact the OIE, and we are very happy to provide any technical support. So that's all from me. Thank you.
Okay, thank you so much, Jing. I'm glad we had better success this time through. We really appreciate the overview. I know, Dr. Gongo, we are strapped for time, so I will just make a few very brief concluding comments for the regional session, the regional partner session. I think what's important to
we have one more.
I'm sorry.
We have one more, Gopi. Yeah, Gopi.
I'm sorry, yes. Okay, my apologies, Dr. Gopi. Gopi is working with FAO, and he is supporting establishment of the tripartite platform on AMR. And I will let Gopi take over from here and present the platform. Gopi, over to you.
Thank you, Scott. I am sharing my screen here. Are you able to see my screen?
Yeah.
Yes, we can.
Great, wonderful. Good morning, good afternoon to everyone. I'm going to spend a few minutes sharing about what's known as the AMR Multi-stakeholder Partnership Platform. This is a global initiative that's been in the works for a little while. And I'd like to give you a very quick history of how it's come about. It started with in 2019 when an interagency coordination group was set up by the UN to report on AMR and governance. And they made 3 recommendations. One of them was to form a global leaders group, which has been formed now. The second was an independent panel on evidence for action against AMR. That's in the works. But the third one is the one I'm talking about today, which is the AMR Multi-stakeholder Partnership Platform. It was meant to be launched in November this year, coinciding with the World Awareness Week. However, the current proposed date is early January, in one of the weeks of January. The partnership platform is basically a place where people come together and then figure out what they want to do together. So the partnership platform is more like a forum from which actions and activities and interventions and new thinking evolves. Who is invited to join the platform? The goal is to get as wide a participation as possible. So the range is from government representatives, UN agencies, international and intergovernmental regional organizations, all the way to the private sector, representing sectors which are either affected by or affect antimicrobial resistance. And in between, we have civil society, NGOs, academic and research institutions, AMR networks and coalitions, as well as international and regional financial institutions, and of course, philanthropic donors. At the current stage, what's going on is that the terms of reference of this platform have just more or less been finalized after a very long public discussion that lasted about a month and finished in September 15th. Going to my next slide. The purpose is to bring stakeholders together from human, animal, plant, and environment interfaces together, and at the global, at the regional, and at the country level, and allow action to evolve from their interactions of disciplines and knowledge and experiences being shared together. I won't go into the details of expected results. Broadly speaking, I'd like to tell you how the structure will work. The partnership platform is an independent structure. It'll have its own steering committee. It would be influenced and guided by the tripartite on the one hand, and by the global leaders group on the other hand, but it would have its own terms of reference, and it would have its own methodology and way of working. So the steering committee sits on top, and they would have an annual plenary meeting. But let me not confuse you about the diagram, but just look at the bottom of the diagram, and you'll see two things there which are key. The most key of them is what are called action groups. Action group 1, 2, and 3 are representative. Action groups are groups of stakeholders that converge and evolve. They emerge from the platform and converge around a specific intervention or an action or an approach or advocacy or literally any activity at all. These action groups are the sharp tip of the spear, if you like, of the partnership platform. Whatever happens through those. By its very nature and constituency, the platform will automatically have cluster groups of clusters of governments, clusters of international financial institutions, clusters of civil society groups. So the clusters will have another role to play, and that too is expected to evolve. What are we doing at the moment? What am I doing at the moment in my position? Currently, we are answering a very simple question. Who is doing what in AMR, in the region of the Asia Pacific? This is the question to which we are trying to get an answer. We're doing it through a mapping survey, which I'm currently working on and leading. So we're looking for people who are working in AMR. For example, all the people in this, most of the people in this Zoom call, for example. And we'd like to send them a very simple questionnaire to find out what they're doing, where they are, who they are, and what their activity is, so that their name could be part of the list of people working in AMR in the Asia Pacific. The second thing that I'm doing is finding an answer to this very interesting question: who are the champions of AMR? Now, I know everyone's working and very deeply involved in AMR. So to say that some are champions might seem a little odd, but we're defining champions as people who go the extra mile, and who are known among the community of AMR people as being especially dedicated or especially energetic or especially influential at any level in promoting or pushing the concept of AMR and the goals of AMR. If you know any such people, we certainly want to hear about them from you. I'm going to end with my last slide here, which is how you could be part of these two things, which is the survey and identifying AMR champions. You could directly write to me or put your email in the chat box if I could pick it up from there. My email is here, chiturgopinath@fao.org. Or as I said, put your name in the chat box and I'll pick it up from there. Thank you very much for your time. And I hope you'll be part of this wonderful, great movement.
Great, thank you so much, Gopi. I think that this platform that Gopi's just shared information about is really another fine example of a tripartite concerted effort. And I think that we continue to try to find innovative approaches and ways to build momentum together as a tripartite to fight against AMR. I think that we've heard, 3 or 4 presentations here from each of the organizations. And while we heard separate presentations on their AMR work, I think what's very clear is that the work in the region is all very complementary and very much harmonized. I think that whether we're looking at the action plans, the WHO or FAO action plans or the OIE strategy, they have complementary elements that focus on awareness, behavior change, decision-making, surveillance, research, governance, policy, and really what we are collectively trying to do is lead the evolution of national action plans to start to really be One Health and incorporate the different sectors and help deliver AMR prevention and control at a country level. I think that the last thing that I want to say in closing is that, we very much recognize that we need to continue to collaborate with additional stakeholders and new stakeholders to broaden our approach, our One Health approach. And in this vein, we're working closely with UNEP to strengthen the One Health work that we're doing in AMR by integrating elements of potential AMR issues in the environment. Those elements may include issues related to soil, water, or impacts of antimicrobials on biodiversity. And this is really early days in understanding the impacts of antimicrobial resistance on this environmental sector. And so we really are really pleased to have UNEP as a close partner for developing this area of work. So with that, I want to thank again all the presenters. I want to thank everyone for their active participation, lots of information coming through on the chat. And we're trying to get back to all the Q&A questions that are coming up. We'll continue to look at those. And with that, thank you very much. And back over to you, Gongal.
Thank you very much. Now we'll have healthy break. First, we'll have a video, documentary video on One Health and AMR, and followed by this physical exercise video. We request you to relax and try to do some physical exercise because sedentary behavior, it is causing a lot of problem like hypertension, diabetes, and some other problems. So we have to practice from time to time. Thank you.
If you want to go fast, go alone. If you want to go far, go together.
The greatest challenge comes from feeding a growing human population and doing it sustainably. That means our food systems have to transform.
We all know that 60% of all human diseases are originated from animals.
The emergence of zoonotic diseases is driven by unsustainable human activities,
such as large-scale deforestation and extraction, the intensification of agriculture and livestock production, the overuse and misuse of antibiotics, and the way we produce, consume, and trade food and other commodities.
no single organization
can achieve success on its own.
And the current COVID-19 pandemic, the global climate crisis, and the slow motion pandemic of AMR all show us
we need even more partnerships than we have today.
FAO, OIE, and WHO, the tripartite, we have creating One Health legacies all over the world.
Let's focus on rabies, where we've made enormous progress over the last 10 years. The OIE Rabies Vaccine Bank has delivered over 25 million doses of rabies vaccine with the generous support of our donors, including the World Health Organization.
The pandemic has shown the interconnected world we live in and how a single disease has affected all sectors of society in all countries of the world, no matter how well or badly they were prepared.
We all know we'll face future pandemic. And now it's time for us to rethink how we can better coordinate our response, build resilience to future pandemics.
To date, the One Health approach has really mostly emphasized human and animal health, particularly through natural collaborations between medical and veterinary sectors. So we need to expand beyond that. We need to include environmental and ecological dimensions if we're going to achieve the truly best outcomes.
In emergency management circles, there's a saying, never let a good crisis go to waste. We have to learn from this event. The United Nations Environment Programme brings enormous internal capability, but it also brings its network all the way down to the state parties, the members, the environment agencies, the partners in the NGO sector as well.
UNEP brings its unique expertise on environmental and wildlife issues in particular. These are complementary to the areas of work already covered by FAO, OIE, and WHO.
We need to invest in ending the overexploitation of wildlife and other natural resources. And we need to invest in changing global dietary patterns. We can protect and secure more land for nature and for its services by farming in a more nature-friendly and biodiversity-supporting way.
For better production, better nutrition, better environment, and better life for all.
Thank you very much. We have re-energized ourselves, and this should be the pattern of our life in our duty station. Now we are going to session 2, monitoring and surveillance of antimicrobial use and antimicrobial resistance in Asia. We have moderator, Professor Vishanu Tamlikitkul. He is an infectious disease physician by training. He is the leader of Thailand Antimicrobial Resistance Program and director of the WHO Collaborating Center for AMR Prevention and Containment, and Fleming Fund host institution for AMR Fellowship at the Faculty of Medicine, Siriraj Hospital, Maidol University at Bangkok, Thailand. Professor Vishanu. Yeah.
Thank you, Gongko. Let's start with the session 2. There are 5 interesting topics from 5 speakers. Let me remind the speaker that he or she should finish the talk within a given time. The first topic is about tripartite AMR country self-assessment, to be presented by Anand from WHO headquarters. Anand, please.
Good morning. Good morning, everyone. Let me upload my slide. Are you able to see my slides?
Yes.
Okay. Put it on slideshow. Great. Good morning, everyone. Thank you again for this opportunity to present to this Asia Pacific region member states and also partners, the tripartite agencies and other partners. I would like to present maybe just a summary of some of the data that's come from the Tripartite AMR Country Assessment Survey. This is an annual survey that is administered jointly by WHO, FAO, and OIE. And we have been doing this survey for the past 5 years, and I would like to just give a snapshot of some key indicators that might be relevant for your discussions further today. So as you all know, there are many drivers to AMR. So the survey tries to capture most of these elements, and the survey questions have been developed jointly by WHO, FAO, and OIE. And we would like to also invite our colleagues in UNEP for the next round of surveys. So we all know the drivers, from the human health side: water and sanitation, environment, aquatic animals, terrestrial, food and feed, plants and crops. And the impact is felt in the community, and there is increased morbidity and mortality. And also in livelihood, is a big impact on livelihood and economic damage. So the questions are designed that cover all these topics. So it is truly a multi-sectoral survey instrument. And this instrument, as I said, is being administered since 2016. And all the data is, can be accessed through this website. Again, it's a joint tripartite website, amrcountryprogress.org. So I would invite all participants to go, look at that website. It has data until last year, and we will upload current year's data maybe in a month. So this year we had very good success rate, 163 member states of WHO, but out of our 194 countries participated and responded to the survey. Despite the COVID pandemic, member states are keen to show progress and keen to support this survey. So we are very grateful to all the regional office colleagues from all the agencies who support this survey, and also our member states for supporting the survey. This is the highest level of response in the past 5 years, 84%. And within the Asia Pacific region, we can say 74% of the countries have responded to the survey. In terms of the survey, this includes specific questions on national action plans and governance, on education and awareness issues, on infection prevention, control, WASH, immunization, surveillance systems, both for resistance and consumption, and how do you optimize use of antimicrobials, and also lastly, environment questions. This year, we had also included a particular question on the impact of COVID on AMR actions at country level. So we are keen to see what the data would show as well. And the data and the responses are based on an A to E scale, and A meaning the lowest and E meaning the highest level of performance. And we have, based on discussions, noticed that any country that achieves level C and above, they are actually implementing at a nationwide scale some of their activities, not all, some of their activities. So that is something to look out for, countries doing better than C and above. So let me just show a few indicators. The first one is quite important. It's about countries that have established national action plans. And here we can see that countries have established national action plans. There are about, I think, 140 countries that have established national action plans. And in Asia Pacific region, it's about 96%. So the countries in the Asia Pacific region are doing very well in terms of establishing national action plans. But what is troubling is the fact that only about 50% of them are implementing those plans. And even among that small group, only 30% have funding for their national action plans. So this highlights a real critical challenge. Establishing national action plans is not the tick the box exercise. You need to have good political commitment and good financing to then implement these plans and provide oversight. The short graph on the right also shows that overall globally, there is human health and animal health have been deeply engaged in the development and implementation of national action plans. But we really would like to point out that there are other sectors that really need to be supported so that they can also engage in the implementation of national action plans and possibly in the future revision of the national action plans. As you can see, plant health, food production, environment are not so high in terms of level of involvement in the national action plans. So this is something that hopefully this webinar and participants can take on board, that some sectors need to be more engaged, need to be invited to participate, but also they need the resources and support to perform and support the national action plans.
Make single slide, please.
Yes.
Because we see next slide also. So participants
okay.
are saying, yeah.
Well, I'm seeing only one slide on my screen. Yeah. Let's see whether this works. Zoom into the... Dr. Gungol, let me just proceed in the interest of time. And I think people will have copies of these slides. Yeah. So the other point to really highlight, and I think this is critical further to the introductory presentations made on by FAO and OIE and WHO, and the nice video on One Health approach. What we see is that in terms of establishing multi-sectoral working groups to manage the AMR national action plans, there is still a lot of work to be done. Even in the Asia Pacific region, only 68% of the countries that responded to the survey have said they have a functional multi-sectoral working group. And by functional, we define it as just a multi-sectoral working group that has even a terms of reference and shows who are the real participants, members of this committee, and that they meet periodically to review data, to analyze what is happening, to then change policy, to also mobilize resources. So without a strong multi-sectoral working group or working committee to manage the AMR National Action Plan, we have seen over the past few years that it really impacts the implementation of national action plans. In fact, there is a very strong correlation. As countries move from level A to level E slowly, then the implementation of their national action plans improve. And even globally, this is a major problem. Only 50% of the countries in the world globally have effective multi-sectoral working groups. So we have a lot of work ahead of us in terms of, One Health is a nice slogan at this point, but to make it a reality, if we don't work on establishing strong, effective multi-sectoral working groups, this will not have an impact on the implementation of national action plans. So this is something that I would really like to stress on. We need to focus on strengthening these multi-sectoral working groups, that they meet regularly and not once a year or once every 2 years, and they review the data. And this is not being done in most of the countries. So this is something we need to really work on. The next slide is to show some indicators on regulations of antimicrobial use. I know this was raised in all the presentations by the tripartite so far. This is a very, very important issue, particularly with regards to food safety. So here we see that the Asia Pacific region countries have done a bit better than global standards. In terms of laws and regulations on prescription and sale of antimicrobials for human use, and similar laws on use for prescriptions and sale for animal use, and then prohibition of antimicrobials for growth promotion for food animals, and lastly, marketing of pesticides, including antimicrobials in plant production. So the Asia Pacific region countries are doing a bit better than the global average in terms of establishing regulations and policies. But the big problem here is the enforcement. It's nice to have regulations, but if they're not being enforced, and if there is not a multi-sectoral group that is looking at this data and seeing that there are regulations that exist, but consumption is going up, then there is a problem. So this is why, again, a multi-sectoral working group needs to be a strong group that looks at this data and finds these gaps and then tries to address it. So enforcement really is a challenge here that needs to be addressed. Now, in terms of systems established for monitoring or surveillance of antimicrobial use, sale, and consumption, again, we can see that human health and animal health are way ahead in terms of plant health and agriculture, in terms of monitoring the use and consumption. And really, in the past few years, thanks to OIE's strong support, the systems for monitoring antimicrobial use in animal health has really improved quite a bit. So there's been good progress in both animal health and human health, and we really need to support the other sectors to also establish these systems to monitor the sale and use of antimicrobials. And for this, of course, we need more resources for those sectors. Now, this is a slide that I would hope that FAO and OIE colleagues could provide more insights. This is not a human health specific slide. This is about infection prevention with regards to good management and hygiene practices in animal food production and food processing. Here again, we can see that the vast majority of countries, in fact, about 50% of more of the countries are in level A and B, and not in C, D, and E. So there is significant room for progress in strengthening, good management and hygiene practices in animal production, animal food production, and food processing. And this has a direct impact on food safety. So here again, I think Asia Pacific region countries, the red bars you see on the graph, seem to be doing slightly better than the global average, but it's still not good enough. I think there needs to be more support for these sorts of activities at country level and in the national action plans itself. So I think I will move to my very last slide, is to really reiterate some points. The first is, unless we have good, strong multi-sectoral coordination mechanisms at the country level, and we just had many discussions with countries, and they responded by saying, everyone talks about One Health. No one is telling us how to do One Health. So I think we need to move beyond this campaigning about One Health, but to really now start focusing on the practical aspects. How do you engage different ministries to come sit around the table? How do you engage the different ministries to participate in the multi-sectoral coordination committees periodically and have the mandate to take action, to look at data? And also the second key point is we really need to strengthen monitoring and enforcement of legislation to address AMR consumption and use in particular. And for this, we need incentives and also disincentives. But this needs to be strengthened in almost all countries, including in high-income countries. And the third one is the surveillance of resistance. So we need to establish systems in most of these countries to strengthen the monitoring and surveillance of resistance, but also consumption and use. Given that the World Awareness Week is coming up very, very soon, I would also like to note that the data shows that, once again, human health and animal health are the majority of the targeted audience. And all this data is coming from the countries themselves. This is not us talking, this is the countries talking. So they are targeting human health and animal health as the key stakeholders for the World Awareness Week messaging and campaigns. And we need to expand that target audience to also include other sectors and other partners. This also is critical in terms of education and training. So lastly, I would say we need continued political commitment and strong multi-sectoral coordination mechanisms at the country level, who can then help mobilize additional resources for the sectors that we really need to strengthen in terms of NAP implementation. And lastly, I would like to thank all the countries who provided submissions this year for tracks, and urge them to continue providing this data on an annual basis. So let me stop there. Thank you very much.
Thank you, Anand. The next topic is about AMC surveillance system in Western Pacific region, to be presented by Dr. Takeshi from WPRO. Please. Takeshi.
Thank you very much, Professor Bisanu. Would you please share my slide, CLO Secretariat? Thank you very much. Thank you. So this is an overview of Western Pacific Regional Antimicrobial Consumption Surveillance System, or we call it WPRO. Next slide, please. So I presented about this for the future vision paper in the previous presentation. Next slide, please. And then we have this regional framework document. And then also we are supporting the member states in line with these operational shifts. Next slide, please. So we do have WPRO, which supports antimicrobial consumption surveillance in the country as a tool for action and also decision making, which is in line with operational shift 4, grounds up. We use geo-intelligence on the ground to inform policy and also decision making. So in the country, there's an antimicrobial consumption monitoring system which uses local intelligence obtained from surveillance. And then those based on those intelligence or the information, we will make action, decision making, and a response. WPRO provides unified monitoring framework and the data collection scheme to generate information and then support the member states to analyze the data and then plan action to inform policy, stewardship, and then clinical management. WPRO has 3 levels of the platforms: national, hospital, and community level. And at each level, WPRO can support building capacity or building system for the country. MC system in the country, and then WPRO support each other, and then at the same time, both of them can further continue to develop in parallel. Countries feeds into WPRO by informing how system in the country works and also by submitting a data. Whereas WPRO support countries to further shape or develop AMC surveillance system by building capacity, supporting collection, analysis of data, and then support informing policy, clinical practice for actions. So this is an overview of how WPRO will support antimicrobial consumption monitoring in the country. Next slide, please. So again, the WPRO objectives of WPRO is to conduct AMC monitoring across our region with the aim of increasing multi-stakeholder accountability and then strengthening stewardship of antimicrobials and the clinical practice to improve health outcomes. This report on the right-hand side is finalized and then being about to be published very, very soon, which have the data from 10 countries and areas, which have submitted the national level AMC data for the year 2018. Next slide, please. We're also building WPRO online stop portal, online platform, where we have a database and the interactive dashboard, again, for the 3 levels, national, hospital, community levels. And then for this year's data call, which is ongoing, we are actually using this national level online platform. So this system will support analysis of MC data and also feeding back to the member states and support less time-consuming data collection and then cleaning process. It will also visualize the results of AMC data for the member states and for the region. Next slide, please. For example, this is how it will look like at the national level online platform. So it shows the country data from like DDD in total or DID, and then also the antibacterials based on the route of administration and also aware category, for example. Next slide, please. This is how the mobile application, which will support the community level antimicrobial consumption monitoring, will look like. We are very much hoping that we could publicize this online, mobile application by the end of this year. Next slide, please. So these 14 countries and areas, they have enrolled to the WPRO and then also assigned a focal point for this WPRO surveillance system. Next slide, please. So we are in the middle of the data call for this year for the national level consumption data for 2019 and then 2020. For this year's national level consumption monitoring for the WPRO, we are going to use the data source from domestic manufacturer and then also importation. The rationales for using such data source is we would like to cover all the resources in the country, which is in the upstream of the procurement chain so that it will eventually going to cover all the field, including the non-human health. Next slide, please. This is one of the results from our 2018 analysis from the national level consumption monitoring. Here we see the percentage of antibiotics by the route of administration. We can see here among 6 countries or on the areas here, approximately 90% of antibiotics are prescribed orally, whereas less than 10 or around 10% are parenteral antibiotics, suggesting the stewardship for the prescription of antibiotics to the outpatient or probably people not in the severe disease are very, very important to reducing the amount of prescription. Next slide, please. So this is the last slide for my presentation. As a way forward, WPRO or Western Pacific Regional Antimicrobial Consumption Surveillance System support AMC surveillance in the country as a tool for action or decision making. And then the second data call for the national level antimicrobial consumption data for 2019 and 2020 is ongoing. This is about the national level, but also hospital and also community level AMC module will be finalized and piloted soon to inform policy and clinical management. So thank you very much. This is the end of my presentation. Over to Professor Visanu, please.
Thank you very much. The next topic is about AMU in animal production, to be presented as pre-recorded video by Delphi from OIE headquarters. Can we have the video?
Hello, my name is Delphi Goches, and I'm from the OIE, from the Antimicrobial Resistance and Veterinary Products Department. And today I would like to present the OIE Global Data Collection on Antimicrobial Use in Animals. So I will start this presentation by introducing first, since when the OIE has been working on AMR topics. So the latest document that we have is from 1952, from the 20th OIE session in Paris. And at that time, even if there was not a strategy on AMR, there was a document from 1948 that was giving instructions to veterinarians about the use of antimicrobials and the prudent use of these molecules. It was later, in 2013, that the OIE held its first global conference on antimicrobial resistance in Paris at OIE headquarters. And during all these global conference, we have recommendations for the countries, but also for the organizations. And for the OIE members, they agreed to collect harmonized antimicrobial use data in animals with a view to submit them to the OIE and to establish a global database. So why this was important, this topic specifically, before the OIE was officially or having a strategy on AMR? Well, before launching this global activity, I would like to say that before the global conference in 2013, we have in 2012 a survey in the implementation of the chapter 6.9 of the Terrestrial Animal Health Code. In this survey, 85% of the countries participated, and we saw that there was a response saying we do have antimicrobial quantities that we could share potentially to the OIE. So these results were presented in the first global conference on AMR that I just presented, and with the recommendation that we saw in 2014, meaning 1 year later, the experts of the OIE ADO group on AMR gathered and reviewed the chapter 6.9 from the terrestrial code and 6.3 of the aquatic code, and this is about the monitoring antimicrobials. And they look at this chapter, this international standard, and from this was the basis to develop the OIE questionnaire, what we call OIE template, and the guidance for this questionnaire and the annex for doing the calculations. So after we had the first draft, the OIE presented all these documents in around between 2014, 2013 to the national focal points for veterinary products in all these regions, and presented to the Americas, Europe, Asia, and Far East and Oceania physically. And Africa was asked by mail what they thought about this document, if it was okay, if they were able to provide quantities in this harmonized way. So after having all this feedback from the 2012 questionnaire, from the recommendation of the Global Conference, from the work of the experts during the ADO group on AMR, and from all countries through their national focal points for veterinary products, we finally launched the questionnaire and documents in 2015 to all OIE member countries. It was also in 2015 that we had a resolution during the general session of the OIE, well, all countries come, about combating AMR and promoting prudent use of antimicrobials in animals. That there was this resolution to the OIE to develop this procedure and standard for quality for collecting data at an annual, in an annual way from all member countries. And in 2016, in the next general session, it was the resolution 36 that the OIE agreed to establish and manage this database and also to develop interpretation for indicators. That means animal biomass. So what happens after this? After we launch the data collection, you can see this map is the one that we just published in the latest report. And all countries marked in green are those that participated. So 160 countries, 60 member countries from the 5th round of data collection participated. So just to remember, this work is based on the international standards from OIE, from the terrestrial animal health code and the aquatic health code for monitoring the quantities in animals. For this time, we already have 7 rounds. We just started the 7th round a few weeks ago, almost 1 month ago. And we already published 5 reports. We are on the way of writing the 6th report that hopefully will be published at the beginning of 2022. And the last participation of this 5th report that was published in April this year gathered 160 members participation. So how it works, the OIE reporting option? We'll say that in a big way, what we have is these 2 big parts, what we call qualitative data or baseline information, where all member countries can answer, and it's about if you have any barriers to collect the quantities, but also about growth motion situation. And then we have the big part, it's about quantitative data. And the OIE proposed 3 types of collecting the data. One is by the classes that OIE propose, and by type of use, meaning growth motion or veterinary medical use. The reporting option 2, in addition, has the animal groups, and reporting option 3 has, in addition, the routes of administration. So all these documents are available through the OIE website. You can go to the website to what we do, global initiatives and antimicrobial resistance. So here under the OIE activities, you will find all OIE reports. You will also find the 5th annual report, questionnaire, guidance, and documents. And for the 5th annual report, we have 3 main sections, sometimes hard to understand. But the first section of the report is about the results of the 5th round from 160 countries, so it's more general. You will not find quantities in here, but situations about growth motion. And then we focus in one single year. Why? Because during a round, countries can provide more than 1 year or different years around the world. So, but for this section, we only focus in 1 year. In this report was 2017 from 103 countries. And then for the first time, we had the trends of the quantities from 2015 and 17 that I will present in a few minutes from 69 countries. So for the results of this report, we'll be very happy to present that the participation of all member countries have increased since the beginning. But not only the participation, you can see that here the dark blue is about those that are providing quantitative data, because if you remember at the beginning, I said that some countries can only participate by baseline information about their obstacles and situation of growth motion. But then we have seen that all the provide quantities have increased, but also for the reporting options. The reporting option 3 has more details to provide, so we have seen a big increase in the last years, and we are very pleased to say that this is happening all over the world. But also we are happy to say that a big part of these countries have been using an OIE calculation tool, and this has helped them to achieve reporting option 3. It's the same situation for Asia. So it's increasing the participation, but also those that are providing quantitative data. And then we have seen an increase here. Maybe we will need to work a little more on reporting option 3, but really the tendencies are very good for this region. Then I was speaking that this is the first time that we are providing any analysis on the trends on time. We were very prudent at OIE to do this because we wanted to be sure, we wanted to also give time to the countries to validate their data sources, to accompany in this process, because when we launched the round, we saw that in many regions, they were doing this analysis of collecting the antimicrobial use in animals for the first time. So it was normal that countries were doing errors. So after 5 years, 5 reports, and after 7 years of working with the countries, we are now, and I think countries are also feeling more secure about providing these data sources. So we analyzed from 2015 to 2017, all countries participating during these years, the same countries. And this is the milligrams per kilograms, meaning that we took their quantities and then we applied animal biomass to analyze it. And what we saw a tendency of decreasing these quantities at a global level in 69 countries. It was a decrease of 34%, and it was all across regions. And I will say that the region that has the biggest decrease was Americas, followed by Asia. So this is very impressive. We have heard that these pronostics, probabilities that in the future animal sector is being blamed for using a lot of antimicrobials. But we are very pleased to say that this is happening at a global level. Really, countries are taking this seriously, and they are taking approach at a national level, and we are seeing these decreases all over the countries. And we are confirming with the countries if they have national action plans, if there is an implementation, making sure their calculations or at least their data sources or data sets are correct. We also analyze these by antimicrobial classes, and we have seen this is all across regions mainly, but tetracyclines are the class that is the most used. But then we saw also there is a decrease in most of these classes. But yeah, the tendency is this one, and we can see it for every region is almost the same. And after is followed by penicillins, but this can vary among each of the regions. So finally, I would like just to talk about the future of the OIE data collection. You can go to the report, there are plenty of information there, but this is something that we wanted to highlight because it's the next generation of this global data collection. And basically here I will try to summarize, but we are planning to release this by the end of 2022, meaning within 1 year approximately. And in this data collection, what we will do, I think it's ownership. This is the biggest one. It's really countries are the owners of the data, so they will have the decision if they would like to share data or not, and in which type of levels. We will have more information later, but yeah, data do not belong to the OIE, but to the countries. That is why in the previous report, you will not find information at a country level, but at a regional or global level, unless the country has a public link to their national reports. So we want to continue with this. Is there really the countries who will decide how and when they would like to share this data through our future portal. Also, we will have these other big components about calculation model, provide any assistance to the countries if ever they need this for calculating antimicrobial quantities. We will also like to integrate with OIE-WAHIS for the animal population. So animal population will be transparent and free for any profile of the countries that connect in a private way. And for the future, we are considering if we will collect data at the species level. So that's something for the future, but we would like to incorporate this for the AMU system. And we will also have the business intelligence reporting. We will be using Power BI, so we'll have dashboards, reports, etc. For the country's profile, but also for the public level. So once we have more information, but we will let you know. But really, this part, we are very pleased and excited about this part, because really we thought that data visualization has a power to take decisions at the country, but also to understand the data. So those are the news from the OIE and about this work, global work for the data collection. And if you have any questions, I will be pleased to join the question and answer session. Thank you very much.
I would like to move the last topic to now, because the speaker has commitment to do very soon. So the next topic is about tricycle ESBL, to be presented by George from WHO headquarters. George, please.
Thank you, Dr. Bisanu. And good afternoon, everyone. Thank you for this invitation. Let me share with you the slides and I will start. So can you see my screen?
Yes.
Okay. So thank you again. Let me just share a summary and overview of this WHO model for integrated surveillance on AMR. I will mention basically what is the principles and why we brought this idea to develop this protocol, this standardized protocol to support countries the implementation of the integrated surveillance on AMR. So this protocol is funded under the strategic objective 2, strengthen the knowledge through surveillance and research. And one of the things that I would like to highlight here is, you know, we have, and I agree that we have been discussing a lot on the One Health. And of course, One Health is a complex topic. And we have different scenarios where AMR is involved. So based on that, and we are requesting countries to establish this national integrated multi-sectoral surveillance system. One of the things that we need to also think is what is the capacity in the different sectors to go and implement this, this integrated multi-sectoral surveillance system. And based on that, we know that there are the most important pathogens that are related with the different sectors, as Salmonella, Campylobacter, Vibrio, and others. But also what we need to know is what is the capacity in laboratory that we know that is countries are working on that to increase this capacity. But I will show what was the one of the main reasons to bring this specific protocol and why we selected E. coli as this as an indicator, because basically what we are trying to do is simplify a protocol to put the first piece of this national integrated system. Something also that is important to mention, this is important because we are working in to develop standards, and Codex at this moment is also discussing and developing the guidelines for integrated surveillance in foodborne bacteria. And this is important because we need to put together the information about antimicrobial resistance, but also consumption and use of antimicrobials. And this is one of the programs that has been very successful in the implementation, and see what is the results of this decrease of the consumption of antimicrobials and also the decrease of AMR due to this decrease of the use of antimicrobials. So this is one of the examples. This is Denmark system that has a long time. They started early 2000. And we, WHO, developed this integrated surveillance guidance, and this was launched in 2017. This guidance was reviewed in the new approach is to guide how countries can establish the monitoring surveillance of resistance, what is the basic and the elemental elements for this and components of this surveillance of resistance, and also how to establish the monitoring or surveillance of use of antimicrobials, and then how to integrate, to analyze the information from both, to really see what is the impact about the use of antimicrobials and the resistance in the system. So this advisory group, the AGISA group, I think that you have heard about this AGISA group. They also, additional to develop some protocols and guidance, like the one as I presented previously, they also supported some pilot projects. And this is just the map of the last goal of the different AGISA projects that were funded in this initiative to support countries to establish this integrated surveillance system. But one of the things that is important to mention here is that we supported all these projects, but at the end, the focus or the target that each of the projects, each of the countries selected to establish as a first piece of this integrated surveillance were different. So at the end, we have different sectors involved in each of the projects, and also the pathogens were different. So in this case was the question during the meeting, the AGISA meeting in 2015 was how can be the best approach, how to establish a global model for integrated surveillance on AMR with One Health approach, with a basic and simplified approach to allow that many countries can start this implementation from the simple piece of pathogens and resistant mechanisms. So this it was the moment when they discussed and established the development of this tri-cycle protocol. So E. coli was selected because we know that in this case the approach was to also go in a One Health approach and not just include the human and animal sector, but also the environment. And this was a new approach because at that point, we didn't have any or not enough information about the environment. So we started to develop this. But the Escherichia coli first is that it's not needed a lot of capacity in countries to isolate from the different samples, and we can find this bacteria in any of the sectors. So the simple one was this indicator, Escherichia extended spectrum beta-lactamase producing Escherichia coli. That also was, the principle was to be feasible, to allow many countries the implementation. And also the idea is to bring this proposal to the government bodies in charge of AMR to embrace this idea and start the establishment of the national integrated surveillance system. And this is one of the things that we do when we propose the implementation in countries, to get the multi-sectoral engagement and the commitment from the government to implement the tricycle. Also require few resources, as I mentioned, laboratory capacity, and that's has been very useful, because when we visited some of the laboratories in the different sectors, they have at least the minimum equipment to isolate E. coli. And also, we also develop training modules and also training, regional trainings to implement this tricycle. And we are also using HUNET as a data information system to collect the data of the different sectors. So at the end, we also standardize the laboratory methodology to facilitate the selection of the ESBL producing E. coli from the samples, and then confirm the ESBL. So again, the aim basically is to provide member states with a common simplified and integrated multi-sectoral surveillance system to detect and then estimate the prevalence of this indicator. So it's easy, but also this can allow them to have some information to analyze and expand this approach to other cities, to other sites, but also to expand in other pathogens and start to build this integrated surveillance that as I mentioned, is complex, and we need to also to establish in the different sectors with different points in the system that we need to know the information. So from the surveillance in humans, we use the same sample from that GLASS is collecting, the bloodstream infection samples in the hospitals. That is to know what is the rates of ESBL producing E. coli in sick people. From healthy people, we selected in the community the group of pregnant women. This was a lot of discussion on this, but this is the common group that we can find in any country. In the food chain, we selected the chicken Zika from the chickens that countries can find in the open markets. And again, this is just points that can be used as a starting point to know more about what is the situation in the different sectors. And for the surveillance, for the first time was developed this protocol in the locations were established in rivers crossing the cities, upstream and downstream. This is directly related with the rates of ESBL producing E. coli in the environment, because it's what is coming from outside from the city and what is bringing after crossing the city. And then from the animal slaughter wastewater and the human community wastewater to know what is exactly the rates of this pathogen. We, additional to that, and also to support countries, we support the molecular characterization. Basically, we are working with the sequencing, because this can allow us to have some relatedness between sectors, and that will also give us more information about how to use this information and make some actions. We also support countries to establish an epidemiology group to support the design and the analysis and see the future development of the system. As I mentioned, it's linked with GLASS. And as my colleagues from Takeshi from WPRO and my colleague from OIE mentioned, the use and consumption of antimicrobials is directly linked with what WHO is doing in this topic, and OIE, as they mentioned, with this. So the idea is that WHO is also supporting how to analyze the use and consumption of information in the human sector, and OIE also support the analysis together with the rates that we are collecting here. Additional to that, this protocol is providing some additional opportunities that can also add to the tricycle, like residues of antimicrobials, advanced epidemiologic analysis, or add additional resistant mechanism as carbapenem producing enterobacteriaceae, etc. So basically, this is what we suggest in the protocol by country to establish this simple system And in 1 year, they can collect some information that can be used to extend this approach of the integrated surveillance, but also to analyze and establish more questions about how to find more actionable information for integrated surveillance. Just quickly to mention, it has been successfully implemented in different countries in Southeast Asia. We have implementing Indonesia, India, and Nepal, and the Western Pacific Asia has been implemented in Malaysia. So, and there are very good examples here. Pakistan is also going to the second phase. And this is what we also now are proposing based on the results of this first implementation to go with the second version of the tricycle. But this second version will be just to see how we can increase the use of this data and how to increase additional approaches that can support countries to continue the building this national integrated surveillance system. So this is from my side. I just, in this complex system, what we are just supporting this tricycle is putting the first pieces that can allow us and allow countries to know what is the situation of AMR with this specific and simple indicator. So thank you very much. Over to you, Mr. Chair.
Thank you very much, George. The last but not least topic is about AMR surveillance in animal health sector in Asia, to be presented by Mary from FAO. Mary, please.
Good afternoon, everyone. I'm Mary Joy Gordon-Silvia from FAO Regional Office for Asia and the Pacific. So just to briefly mention about what we are doing in the animal health sector with regards to AMR surveillance and how this is leading towards a One Health approach. As has been shown by my colleagues from OIE and WHO, we are contributing, while OIE is strengthening capacities towards antimicrobial use, and WHO is contributing on antimicrobial resistance and antimicrobial consumption data for humans. FAO is focusing more on the strengthening of surveillance and research to support evidence-based decisions. So all our respective action plans and strategies are leading towards and contributing to evidence-based One Health decisions, interventions, and initiatives. While we are doing this in separate streams, we are in a way coordinated and linked together with our objectives. We go by the principles. What I will be mentioning here is what we are doing in the animal health sector in the region. We go by principles, and one principle, of course, is that strengthened food and agriculture sector is an essential foundation for AMR surveillance, and of course, for overall One Health approach. AMR is a recognized complex issue and best addressed with a well-covered and well-linked force from all relevant disciplines. This is One Health approach. While there are specific issues and concerns for AMR in the animal sector, in the agriculture sector, there are also specific issues and concerns with the human health sector. And what we need is strengthened capacities for each areas, and of course, strengthen coordination mechanisms so that we can also cohesively address shared issues and concerns. And by this, of course, we address overall antimicrobial resistance, including antimicrobial resistance surveillance. In FAO, given this principle, we are focusing. AMR is a rather relevantly new theme for food and agriculture sector, as you probably know. Although for some countries, this might have started a long while. But what we are focusing on are how do we contribute to strengthening capacities in these areas. So we are looking at different aspects of the work in the region. And as you can see here, there are different areas that we are strengthening, to improve monitoring and surveillance, not only of antimicrobial resistance, but also support our work of OIE on antimicrobial use, as well as antimicrobial residues. So one is by improving the tools for AMR surveillance in food and agriculture. We are coming from a different context. We have different messages for our stakeholders, and we need different tools as well. As mentioned, these are relatively new area of work for food and agriculture. So we're developing guidelines, developing templates, we're actually developing customized sensitizer plates and improving AMR data management overall. So we're building on this tool so that it will be made easier for that agriculture sector. We're also working with countries as well in systematically improving and progressively improving AMR surveillance systems. There is a global tool, which is called Assessment Tool for Laboratory and AMR Surveillance Systems for Food and Agriculture. And this is what we are trying to roll out in the region. So far in Asia, we have done 15 countries in Asia and 31 national AMR laboratories. This is supported by an array of Atlas assessors coming from different countries as well. So in this way, we are able to identify what areas are specifically needed by the countries to improve their capacities on AMR surveillance and focus in those. We're also helping progressive strengthening of national AMR laboratories. So we do this in collaboration, of course, with Chulalongkorn University, which is an FAO reference center, through regional laboratory trainings, proficiency testing, and advanced trainings as well. So this is our ongoing initiatives. We're also, aside from this, we're also setting up networks of expertise on AMR in agriculture. As I have mentioned, this is a relatively new area of work for the region. And so we need all the expertise and support that we can get. So we have set up the AMR Technical Advisory Group for Southeast Asia and South Asia. And from this, we have technical items that needed support from specific technical expertise. So we're creating ad hoc technical working groups. And of course, we also have the partnership with the FAO Reference Center for AMR. Within the region, that we have one globally designated one, which is Chulalongkorn University, as I have mentioned. But we also reach out to other FAO reference centers globally, depending on the needs for expertise. Aside from this, we are also establishing broader coordination and partnership. One of these is the FAO-OIE flagship initiatives, regional consultation platforms, of course, tripartite coordination. And some of the work that you will see that I will be sharing here are mostly coming from the contributions from different countries, through their technical expertise and inputs to the work that we do. And lastly, progressive improvement and sustainability. We do this by, as I have mentioned, we are doing assessments, and progressive improvement and sustainability is achieved by integrating planning, what are the findings from these assessments, and progressively addressing what are the priority gaps and move forward with this. This year, we started the AMR Surveillance Capacity Enhancement Drive, or ASCEND, which targets specifically for countries to address the recommendations from Atlas or request Atlas missions for their countries as well. So this is from the first principle of strengthening the capacities of food and agriculture sector as a contribution to the overarching One Health AMR surveillance. Second, it might be of interest to know that food and agriculture has various areas of accountability in a One Health approach to antimicrobial resistance. There are areas we're working on to monitor and focusing on AMR monitoring and surveillance in bacteria from healthy food, animals, and their products, including for residues. So these are those that enter the food chain, meaning these are coming from healthy animals, and any incidents of resistance could affect the human population. Another area, and probably there are less people involved, this is more to improve the use of antimicrobials, because we're also looking at strengthening capacities for AMR monitoring and surveillance in bacterial pathogens from deceased livestock and from pathogens from aquatic animals. So these are specifically mainly to address, of course, while humans have issues on infection, animals have also issues on infection. And as coming from this agriculture sector, we need to address those as well. So these are specific because the antibiotic panels are different, the approaches are different, the capacity strengthening is different. So this is another area, but in a way, the impact of this is that it can contribute to improving antimicrobial use and stewardship. One other aspect that we contribute to this integrated surveillance is through monitoring antimicrobial use at the national level, as mentioned by OIE, but also at the farm level. So in addition, we are also working, of course, on knowledge, attitude, and practices in the use of antimicrobials in food and agriculture. As you can imagine, there are different messages, there are different drivers for use. And I think this is also an area that we are working on. So one other thing, that just to show you how we are addressing these different approaches, we're developing a series of guidelines for the different areas of work that I have shared with you. These are guidelines for different areas of surveillance and also supplementary tools. So for example, one thing that you will find already published is the AMR surveillance in bacteria from healthy animals. This comes with a supplementary tool for AMR data management and also testing a regionally customized MIC panels for this that are actually in the manufacturer's library and can be accessed by countries. So these are just some examples of what we are doing to reinforce and support these different areas of work. For your information, by the end of the year, we're hoping to have the second and third volume available, and maybe early next year will be the volume 5, and then later in the year would be volume 4 and volume 6. Third principle, countries in the region are at different stages of capacities. I think you can have an appreciation that different countries in the region has different needs and are at different levels. I have mentioned earlier about the assessment tool for laboratory and AMR surveillance system for food and agriculture, or what we call as ATLAS. Findings from this we are collating, and what you can see here are the different stages of capacities of the countries. There are those that are so advanced and those that are just starting. What is important is that everybody initiates and move towards a cohesive work and a shared vision. So what we are trying to do, for example, this is the phases of work that we're doing for healthy animals, where there are convenient entry points for initiation. This is just to trigger and encourage countries to initiate surveillance, but having an orientation and having a vision of where they want to get to. Because it's important to have harmonization of approaches. As you can imagine, if there are different methodologies, different pathways, we cannot bring this information together. So we have we are shortchanging the opportunities presented to us without harmonization. So at least as we go, as countries proceed, there are tools that are accessible to them to help achieve this goal. And as I have mentioned, for ATLAS, we're working on progressive improvement pathway, or what we call as PIP. This is the way by which countries are progressively improving in their aspect, and through ASCEND as well. Maybe one thing that I would like to highlight here is that one opportunity that presents is that, given the fact that countries are at different stages of progress and process of capacities, what's happening also is that countries that are very advanced are supporting other countries that are initiating. So this is something that's also that's also being cultured in the region in an organic way. So that's what's happening. Principle 4, there are also cross-cutting gaps shared by countries in the region. So one thing that we also noted when we were doing assessments is that regardless of whether countries are advanced or countries are behind, one cross-cutting gap is on data collection and analysis, for example. See, this is the most common AMR data, most common gap. And so as a cross-cutting gap, FAO Regional Office is putting a priority to this cross-cutting gap. So we are addressing this more intently. So we view this as a collective support for the region. So through this, for example, we have seen the cross-cutting gap on AMR data management. What we have been trying to do is improve this and leveraging on the lessons also that's coming from the health sector. For example, in the region, what we are working on now is how can we utilize HUNET for food and agriculture. Currently, we have an active work with the HUNET developers to create a separate program or a separate software that's subsumed within the HUNET, specific for food and agriculture, so that this is more easily accessible for countries. And also it's more adapted to the needs of the AMR surveillance structure for the region. And so this is also aligned with the regional AMR data management templates. As I have mentioned, countries are at different stages. So if they're more comfortable to just use, say, Excel template for AMR data management, it's there. But when they are ready to transition to the new technology, new software, it will be easier for them to export because there are interoperability for this device, for these softwares. So the idea being that this will be more for the national initiatives, how they will be able to bring together the information that's coming from different agencies in the country. And if they choose to, they can bring this to the regional level and to the global level if they choose to. So that's, again, the important thing is that we strengthen the national capacities in this aspect. So finally, it is important to begin with the end in mind. And this is just not AMR surveillance in the food and agriculture sector is being designed in a way that what do we want in the end, which is, of course, evidence-based policies in food and agriculture, and something that protects, of course, the human health as well as advance, protect also animal health and production. For overarching design, there are specific tools, as I have already mentioned, and for each step of the way, FAO is trying to support overarching design, data generation through capacity building, and also training, proficiency testing, tools such as the customized microbroth dilution plates. And we're also developing the bulk mechanism, meaning the bulk mechanism, if a country is interested to procure, regardless of the numbers, you're trying to work out that all these collected numbers will be the basis for the pricing. So it brings the cost down across the countries that are participating. We're also supporting on data management and analysis. As I have mentioned, we have the AMR data management template. We are working with HUNET for some programming and non-programming work, including training and capacity building, and continuous consultation with the technical working group. For information, we have set up the AMR technical working group for AMR data management. We also are involving experts and regional networks in this work. And of course, for policy recommendation, at least it's where the work on surveillance is being brought in with the science at hand, so that the advice will be sound and evidence-based, so that in the end we develop evidence-based policies in food and agriculture. So it's still a long way, but I think looking back from where we started, I think there's already a lot of progress that has been achieved for these different areas of work. So it's not just to generate data, but take the opportunity to strengthen the capacities of people that are involved in this work. And so just to mention here that this is a brief overview of the work that we are doing in the region, and I will post in the chat box later, so you can take a look at this work here more closely. If you're interested to find out what we're working, what activities we have for each area, this is that area of work. And furthermore, I will also post later the other FAO resources that are coming from the global scenario. So we also have those, aside from those that I have mentioned here quite briefly, because in the interest of time, I'm just cutting this short, but let me end with, again, showing this slide where we started, showing that each and every work of the tripartite is building towards each other and addressing the need for evidence-based One Health decisions, interventions, and initiatives. So with that, I'd like to thank everyone for your attention, and of course, the people behind this work, the AMR team at FAO, and our colleagues in OIE and WHO. Thank you.
Thank you, Mary. I'm sorry that we don't have enough time for Q&A session, but the speakers will respond to your queries in the chat box and Q&A box later on. So I would like to thank our speakers and audiences for joining this meeting. Now I would like to hand over the floor to Congo.
Yeah, thank you very much. We would like to thank all moderators and presenters, as well as participants. We could see a lot of interaction among participants. That is great. The key message here is surveillance, surveillance, surveillance. We have to generate evidence-based, science-based data and information to inform policy decision. Data not for the sake of data, but we have to take decision, policy decision. So that is necessary. As Professor Vishanu has mentioned, in Q&A, we saw few questions. We'll respond and request presenter to provide response. And we would like to request you to send us feedback as on the webinar arrangement by completing evaluation form, which we can do tomorrow. Today, we have overall presentation of Tripartite One Health package. So FAO-OIE-WHO, what we are doing for the benefit of member states, for the prevention of this silent tsunami, this antimicrobial resistance. So that is very, very important. And I would like tomorrow we'll have more on country experience. We are trying to have panel discussion, which will be more important. And sorry, we exceeded 20 minutes, but tomorrow we assure you that we'll not go beyond 2.5 hours. Using this opportunity, I would like to thank Chitra and Frida who are working behind for technical support, Indu and Ravinder for technical administrative support, Kanchan and others for IT support. And tomorrow we are meeting at 10 a.m. New Delhi time, and we hope that it will be more interesting and we'll have more participants tomorrow. Thank you. This webinar is adjourned for today. Okay. Yeah, so. So it's still 100.
Thank you, everyone.
Maybe FAO-OIE-WHO, we may have 5 minutes just to overview what works, what does not work, and so that we can improve tomorrow.
Everyone, goodbye.